Hi, I'm Ganesh Rao. I'm the chair of neurosurgery at Baylor College of Medicine. I'm also the physician leader for the Catholic Health Initiatives and Neurosciences Texas Division. You are listening to Interview with the Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Ganesh Rao, Chair of Neurosurgery at Baylor College of Medicine. Doc, how are we doing today?
Great. Thanks for having me.
Thank you for being with us. So, getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
So I actually went into residency not knowing much about what life was like on the other side. I was excited about the opportunity to do neurosurgery. I went to the University of Arizona for med school, and I matched the University of Utah in Salt Lake City, which was a great place to train. Beautiful city, fantastic program. But I was really kind of uncommitted in terms of what I was going to end up doing. I knew there was, in vague terms, you could be a private practice neurosurgeon, you could be an academic neurosurgeon, but I really did not have a sophisticated view of how that went, or those two different things, how you achieved either one of those two. And so naturally, when you're in residency, you're in an academic environment, but you have the opportunity to interface with private practice neurosurgeons. And I think you make a decision kind of early on. I mean, if you want to do kind of very exotic cases, those tend to happen in academic settings. And if you want to do research, that pretty much exclusively happens in academic settings. I had done some research as an undergrad and as a medical student in a wet lab doing research on brain tumors. And I gravitated towards that in residency and spent 2 years in a lab with one of my mentors doing that work. And I knew at that point, okay, if I want to really continue this, I'm going to have to stay in an academic environment. And so pretty early on, I knew that that was where I was headed. And so that, once you choose that path, and it's even more competitive now. I mean, this is many years ago when I finished residency in 2005. So back then, if you were going to have a lab, if you were going to be a real academic researcher, you needed to have the box checked. You needed to have spent some time in a research lab during residency, and you also needed to have some good publications and that sort of thing. And I came out of residency having checked those boxes, so to speak. And I had three pretty good offers in terms of places that would support my research and give me a practice that was focused on oncology, which is what I wanted. I've got friends who went into private practice out of residency, and they knew what they were getting into. They knew it was going to be a lot of community practice, mostly spine surgery. That's what they liked. I would say coming out of residency, they were more knowledgeable about looking for a job than I was. It's a very different, as you know, very different mentality, and you're looking at things differently. And so I did a fellowship, and part of that was also, I did that fellowship at MD Anderson Cancer Center, and part of that was strategic because oncology is very competitive. A lot of people want to take out brain tumors. It's a very exciting field. And so you have to kind of have your ticket punch, so to speak. I had to spend a year focusing on that, really honing my skills, that sort of thing, and then jobs, sort of came after that. So, you asked about, what did I do during fellowship? It really was getting, focusing, really kind of doing deep dives on particular things, learning skills, and then hoping really that would lead to opportunities afterward.
So, kind of taking us through that fellowship year, what was your mentality getting into your first job search, and how did that perspective changed in the beginning years of your career?
Yeah, it's a great question. So, you go into fellowship, okay, I'm going to focus on this area of neurosurgery. And the reality is that the job, and I was at Anderson as faculty for 15 years. We trained 3 or 4 fellows a year, and every year it's completely different. I mean, the job market, it's feast or famine sometimes. So I didn't know what was going to happen at the end of that year. I mean, I went in, I came to Houston in July. I, had no idea what I went to my chair at the time, Ray Sawaya, who was a real mentor to me. And I remember in August, I walked in his office and said, how do I get a job? Like, what's the process here? Like, how do I do this? And he actually, a lot of jobs are word of mouth. A chair will call another chair and say, hey, I need somebody for X. Do you have anybody come out of your program? And there are advertisements, as you know, there are people who can help you find a job, but not all jobs are kind of advertised. So he had been contacted by the chair at Case Western Reserve through an email saying we're looking for a tumor person. So that was job number one that I was looking at. Job number two actually came through a recruiter, was working at for the University of Rochester in upstate New York, and I went out there and interviewed. That was job number two, and then through a series of events, a job materialized at MD Anderson, but very late in the game. The second half of my fellowship, they didn't know that if they had anything. And then Dr. Sawai came to me and said, "Hey, look, there may be an opportunity here." But I went to Case Western, I went to Rochester, I went to those places twice. I went with my wife. I wanted to make sure she was going to be happy living in those cities. All the offers were extremely different. One of the offers, the salary was a little bit higher, but you had to cover 3 or 4 hospitals. They were providing me resources from my lab. There were people there that were willing to mentor my research. It was very, appealing. The second place had a similar kind of vibe to it. The difference was they were not going to be able to offer me any piece of the production bonus. So because they were subsidizing my research, they said, "Look, even if you do a bunch of cases, we can't pay you the bonus," which is a little bit off-putting, but I understood it, right? I mean, when you go into academics, you make these choices. The Anderson job, to be perfectly honest, was the least financially favorable job. The salary was a little bit lower. The resources they were giving to me were a little bit lower, but the institution, is really strong, has a great name, and I kind of knew the place having been there for a year, and I don't regret staying there. I mean, I think I was there for 15 years, like I said, and I was able to succeed, and part of that, the institutional name helped me. I wasn't, people don't come to a place like that looking necessarily for for a person. They come there because the place has a great name, and so that helped me early on to build my reputation, because I think patients come there and they say, "Oh, well, if you're at MD Anderson, you must be good," which I like to think is the case. And so that ended up helping me, because I didn't have to go out and meet people and establish a referral pattern. That's the real world, though. I can tell you, having come over to Baylor, where it's the real world is you have to hoof it. You've got to go out and you've got to make a name for yourself, and you got to give out your cell phone, your business card. And you've got to say, it's like being the rookie on an NBA team. I mean, you got to prove yourself. You're not going to get any touches, right? Nobody's going to pass you the ball unless you're like a major superstar. So it was a very different world, but one that served me well in terms of that job. So 3 very different opportunities. I took the one that initially probably what looked like the least favorable on paper, but ended up, I think, being the right one in the end.
And now moving forward, can you briefly take us through your journey on how you became the chair of the program?
Well, it's kind of a long story. So, boy, at some point in your career, you will decide, if you're in academics, that you want to lead a program. And that's a really tough one to, it's a lot of headaches, a lot of heartache. I mean, again, at some point in my career, I thought, this is something I want to do. I want to lead a program. I want to, and I interviewed, although I'm the chair at Baylor, I did interview at other places for chair. Some places, you'll have this sort of mass email that goes out to everybody and says, "Hey, we're looking for a chair at the University of X," and I don't know how many hits they get. Some places will have professional firms doing the search, so they'll reach out to you. They'll get once you get to a certain age or a certain point of your career, these emails just come to you. And so there are certainly places that I was interested in that I applied for, and they got my initial email, and then I never heard from them again. I think that's sort of that happens. Probably the 3 or 4 places that I looked at seriously and actually was entertaining the job were places that were either on the rise or very well established, and that leap to becoming a chair, I think, is one that you really have to do a lot of soul searching. There's so many parts of it that you have to consider. I mean, it's a family thing. You're going to be much busier. You're taking recruits to dinner. You're not home and you have to give it part of your practice. I mean, I'm not nearly as busy as I was surgically before, but because I'm doing other things. The one compromise I wasn't willing to make was give up my laboratory because I'd spent so much time, getting NIH funding and writing papers and stuff like that. And I was told by a lot of chairs who were very successful that when they took the chair job, when they ended up doing it, that they gave up their lab, that they said it's impossible, I can't do it. And I think that that's true and not true. I mean, there are plenty of surgeons out there who are chairs who have maintained their labs and are very successful. It's one of those things where if you really want to do it, you have to make the commitment and do it. And so I would encourage anybody who's considering a chair job. You do have to give some things up, but what's important to you, you shouldn't compromise on. And so the chair job here is very, it kind of fell into my lap in a way. I mean, I was across the street at MD Anderson. I was the residency program director. So I had been very involved with Baylor for many, many years. And all the faculty at MD Anderson are adjunct faculty at Baylor. So we know the program and we know everybody. And Baylor is actually an affiliation of 5 hospitals. So we're a big program. But Dan Yosher, who's the former chair here, became chair at Penn right before, right, I think as the pandemic was hitting. So the job opened up here, but there was a search. I mean, despite the pandemic, there was a lot of Zoom interviews. It was very different from my other chair searches where you go to dinner with a bunch of people and you're face to face with everybody. And the Zoom interviews were very different. I mean, you had to really, it's a whole new world, right? Like, how do you interact with somebody? I mean, we all sort of get used to reading body language and facial expressions and integrity and sincerity, and you have to really project those things on an interview and really bring your A game. It's a little bit harder, I would say, but went through that whole process with multiple people. I didn't meet the president of the hospital until I signed the contract. So, which is crazy. I mean, the other chair interviews I've been on, you're meeting these people very early on in the process. And so it's a different world, but when Dan left, the other thing is, and I'll give a colleague of mine, Brian Ho, credit for this. So Brian is the chair at Florida. I think you've interviewed him actually. I'd interviewed for another chair job. I'd gone for 3 visits and I was this close to signing the contract, to moving to that university, leaving MD Anderson and going there as chair. And man, something just didn't feel right about it. It sounds crazy, but you think we're all very pragmatic and scientific, and I something didn't feel right about it. I actually talked to Brian about it. I said, man, it just doesn't feel right. And he said, sometimes your gut is the best barometer. Like if it doesn't feel right, he said he trusts his gut all the time, which I found crazy. Brian's a very accomplished guy. He's also NIH funded. He's a scientist, has a great program at Florida. And so I was really encouraged to hear that. So I turned that job down and I don't regret it at all. And so when Baylor came up and I interviewed, everything felt right. Like you just sort of have this feeling like this is where I'm supposed to be, or this is the natural next step. And so I wouldn't discount that feeling of, am I excited about a place and that sort of thing.
So now thinking back, what would you say were some of the keys of your success that shaped your early career as you climbed the ranks of the academic world?
Boy, that's a great question. So a lot of things. And I try to tell the new assistant professors as well, particularly ones that are in academics, you have to learn how to say no sometimes. That was very hard for me. And in fact, I'll give Ray credit for this as well. We would do an internal review of our progress about 3 years into your job. So you're an assistant professor, you're brand new, but you're trying to climb the ladder, as you said. I mean, at some point you got to get promoted to associate professor and then full professor. There's a clock that's ticking. That clock doesn't stop for anything. And the metrics for promotion vary by institution, but if you're on the tenure track, depending on your institution, they want to see academic productivity, they want to see publications, they want to see grants, they want to see a national reputation. Are you giving talks at meetings and that sort of thing? So when I first started, I was super busy. I did a bunch of surgeries, and people are coming to you, right? I mean, the oncologists in my particular field are coming to you saying, "Hey, I've got this patient with a brain tumor. Can you take care of it?" And you're like, "Absolutely." I mean, And then eventually you realize, God, the more I keep saying yes, the less time I have for these other things. And so at my 3-year review, so I'm about half the tenure clock is different for all institutions. So at Anderson, it's a 7-year clock. So basically at 7 years, you're either going to get promoted or you're gone. And so about 3 years, and that's the way it is at a lot of places. So at 3 years, we had an internal review, and one of the head and neck surgeons reviewed my portfolio, my publications, and all that sort of stuff. And he knew how many cases I was doing. And he said, he was blunt. He said, "You're doing way too much surgery. You're never going to make it on this track. You've got to start saying no, or you've got to figure out how to like get stuff out of your lab." And that was like a punch in the face because I thought I was doing great. And I was like, man, I have to, I have this lab. I was given startup money. I go there, but I don't really do much. And so, or I hadn't been productive. And so I buckled down. I started saying no. I stopped seeing patients on off clinic days. I stopped doing surgeries on days where I didn't have block time. And that helped me. So it was a lot of time management. I mean, you asked a question about how did I climb the ladder? I mean, I tell people that in many ways you want to be generous. You want to help people along the way. You don't want to kick down that ladder while you're climbing it. You want to bring people with you. So be generous when you can, but in terms of your own career, you have to focus. You really have to and you have to set milestones for yourself. Like, I'm going to get so many papers out. I'm going to apply for this grant, that sort of thing. And that's the academic world. I think in the private world, it's quite a bit different. Obviously, you don't have this idiotic tenure clock, ticking, and you don't have all these other external pressures. But and certainly in academics, these are the things you don't even hear about, right? You don't know. Oh, I got to be promoted by 7 years, or I have to do, X, Y, and I have to do this many papers. I mean, it's sometimes a wake up call to people who have not heard about it. And then they're behind the 8 ball, and it's hard. And I can tell you, I've seen a lot of people who have a lot of promise start these academic jobs, and then 4 years out, they're gone. They decide, I can't, don't want to do this, or I didn't have enough stuff. I'm going into private practice, or I'm coming off the tenure track, and that sort of thing. So lots of things to think about when you first start.
Now, being the chair of the program, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Yeah, so we go through this every year. A lot of it really depends on what the chief wants to do. So if they're headed for private practice, they want to do general neurosurgery, that's probably the easiest path. There, the decision really is, where do I want to live? The nice thing about neurosurgery is we've done a pretty good job of, not flooding the market with too many of us. It's 7 years to get through. And, you need neurosurgeons are in demand. I mean, you need somebody at a hospital who can deal with a traumatic brain injury or some of these things. And so, if you're interested in private practice and general neurosurgery, that's a path of least resistance. Then it's often, where do I want to live? What practices? One of our chief residents this year is from Oregon, and she wants to live in Oregon, and she had some fantastic offers there. And I think we picked a great place to work with great partners. It's about culture, the people there, your partner is going to support you, that sort of thing. If you're going to private practice, you have to think about things, as you know, Matt, things like partnership track, and do you have a buy-in? What's your RVU target? Do you have to work like a dog for the first 5 years, then you can sort of back off? The other advice I give people is that first contract you get, this is true both for academics and private, this is a long game. Your career is like 20, 30, 40 years. And so that first number that you see is not as important as maybe the number 5 years from then. Like what are the guys that have been in that practice for how are they doing? What's their life like? Are they having to bust their hump, like, work like a dog? What's their bonus situation? If they hit a certain number of RVUs, is everything over that sort of gravy, that kind of thing? So these are things you got to think about. And I think we do a terrible job of teaching this to our residents. I mean, we try to tell them what an RVU. I didn't know what an RVU was, I think, until I graduated. So we have to do a better job in that regard. We try to do that here in our program. Academics is a totally different story. So we have people that want to go into academics. And then, as we were talking about before the call, the leeway you have with your contracts is, I think, a lot less. In the private world, there are things like signing bonuses, and there's sometimes debt forgiveness, and there's sometimes even like, these other bonus structures that can be negotiated. The academic world, a lot of contracts are, if you're going to a state university, you just basically get this one pager. My contract at Anderson, I remember, was one page. It basically said, you're going to make this much money. Everything you do will be for the University of Texas. Sign here. That was it. There was no, you'll get a bonus, or if you do this number of cases, that doesn't exist. And Baylor's a private institution, but we're pegged towards, the various agencies like AAMC or MGMA. So we offer, I think, a competitive salary, but the wiggle room there is some, but it's not a lot. And so you have to understand, if you're going into academics, what you're trying to negotiate may not be salary necessarily, but it might be other things. It might be, I need 2,000 square feet for my lab, or I want, $500,000 in startup funds so I can hire people to do my research, or I want these other things that aren't monetary necessarily, but I know they'll help my career. And so that's where you kind of have to sort of pick your battle. And the other thing is, I tell people that are going out, talk to as many people as you can about their job. What mistakes did they make? What do they wish they had done differently? Should they have asked for protected time? Because if they want to have a lab, so those are things that, and the list goes on and on. I mean, I think family is very important. I mean, is your wife going to be happy living in the Midwest, for example, if she's never lived there, or he's never lived there? So those are things that you have to think about. That's I see a lot of that too, where a spouse will follow a neurosurgeon to a city they've never been in, and they hate it, and 3 years later they're like, you can't live here, and they have to move. So you don't underestimate geography. That's also extremely important. And then finally, I mean, maybe not finally, but culture is also extremely important. I mean, if you meet a bunch, you go to dinner with these, and you can't do it now on Zoom, which is tragic, but going to dinner with the group, and making sure that you all get along, are there red flags, or people coming and going? One of the red flags that's out there is there's a partnership track, but it's a huge buy-in. And so they work you like a dog for 2 years, and then you're not going to make it, or you haven't done enough. And then you got to leave. I've seen that a few times. So you've really got to do due diligence in figuring that out.
Now, having dealt with the pandemic in 2020 and also now in 2021, what advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
Yeah, challenging, right? So I think that networking is so important in our field, where everybody knows everybody, right? I mean, I think you probably know that as well, right? It's a small world. There are 4,400 board certified neurosurgeons in America. We're like less than half of 1% of all the physicians in the United States. There's only 117 training programs. I mean, we know everybody. And so in terms of networking, it's hard now, because at national meetings, you would be able to talk to people and get to know them. It's virtual now, so it's much more challenging. You need your mentors to help introduce you to people. A lot of it now is, can you talking to your faculty and saying, can you help me find a job? Do you know anybody at X, university of wherever, and are they looking, and that kind of thing. That's really what it's coming down to now, is that sort of thing. And then when you get a Zoom interview, or when you get an interview, I've done a bunch of these now. We as we try to recruit people, the Zoom interview is great. It's actually been a good first pass. You can sort of get to know somebody it's superficial, but at least you can kind of get to talk to them. But inevitably, you're going to have to make a visit. Now, we've hired one person, actually, Dr. Yoshida, before I started, purely over Zoom, which is remarkable. But for the ones we've recruited, the ones we've talked to more recently, it has been. In fact, I hired someone mostly over Zoom too, but on both sides, you have to do due diligence. So you, as somebody doing the hiring, I've had to call, and because I can't meet with the person in the flesh, is this person a good fit, a good person? On the other side of it, as a applicant, you've got to do the same thing. You've got to call and ask, is Dr. Rao a weirdo? I mean, does he treat his people well? That kind of stuff. I mean, these are things that you have to do on your end, and you shouldn't feel shy about it. I mean, this is your job, right? I mean, you're going to commit to moving to a place and living there and working for somebody, and you've got to make sure that you do due diligence. I think ultimately a visit out. So if you go through 2 rounds of interviews and we're able to travel now. It's a little bit restricted, but we've brought people out. I think for that final kind of, am I going to do this? It's really important that you go out, with rare exception, unless you really know a place that, you've lived there maybe in it before and that kind of, and that was the case with one of our faculty who knew Houston. And so even though he didn't come out, he knew what he was getting into. But if you don't, I think that there ought to be some going out, seeing the physical plant. What's the hospital like? An operating room's an operating room. So maybe that's not as important, but where can I live? What's the city like? Those are important things that you shouldn't minimize.
As the leader of the program, what type of things are you looking for when you're interviewing medical students for residency spots and also residents for fellowship spots?
Yeah, that's a great question. Yeah, I mean, it's changed over time, having done this for a long time. It used to be, you have good board scores, you have good grades, maybe a little bit of research. And now it's so much more competitive. I mean, we got 397 applicants for our 3 spots this year. And we interviewed 48, I think. So we have to whittle down a lot of people. And then of those 48, only 3 are going to end up here, right? And so what has changed, I would say, is, so the step 1 test, the USMLE, the licensing test, is now going pass fail. So this is the last year where you get a score. And that score was mostly meaningless, but it told me whether or not you could take a test. And if you passed it, great. If you pass it really well, even better. If you barely pass it, then I'm going to be like, I don't know, right? Like if you're barely passing that test, it makes me worry about, not only you being able to pass the neurosurgery boards, but there's a cognitive component to test taking, but that's going away. So they took away that score. Med school grades, a lot of them are pass fail. And so you can't really tell now, what somebody's cognitive abilities are. That's where the interview becomes even more important. So what has changed for us is, are you personable? Can we talk to each other as human beings? Do you have hobbies? Do you do stuff that's cool? And then the other thing is research. So neurosurgery now, and I've changed my tune on this dramatically. It used to be like, if you didn't have a year of research, I didn't think it was a big deal. If you had some papers, you had good scores, you were going to be competitive. Now it is so different. If you look at the national, the match results, every year the match puts out, the NRMP puts out a booklet of a lot of statistics on who matched. And one of the criteria is research experiences. And neurosurgery, compared to other specialties, whether it's derm, plastic surgery, really competitive ones, we are off the chart. I mean, a couple of years ago, maybe it was last year, the average successfully matched applicant had 12 research experiences. I mean, it's not trivial. So you really, and I tell people, look, if you don't have it, if you didn't come in with a PhD or you don't have a lot of experience, take a year off. It's 1 year. It'll make you way more competitive than if you don't do it. And so that has changed in terms of that. In terms of fellowship, it's a little bit similar, but a little more refined. So, we're looking for people who, if they want to do a fellowship, why do you want to do a fellowship? Do you really need this extra year of this? What have you done in the past to set you up for a fellowship? And, obviously at Anderson, I was more involved in the oncology fellowships, but and then it's afterward. If you're going to come here and spend a year learning this, are you going to do academics? Are you going to take what you've learned here and take it to an institution where, you're going to be the expert in brain tumor surgery or spine tumor surgery or whatever? If you're going to go into basic general practice, number one, I'm not sure you need to do a fellowship. And so, those are kind of the things that come up when we interview fellows.
So having been a former president of the CNS, what type of initiatives and resources are you providing to the next generation?
That's a good question. So at CNS is very focused on education. And so we spend a lot of resources on things from residents, for people coming just into practice. One of the most daunting things in neurosurgical progression is the oral boards. So unlike every other specialty, we don't get board certified till we're about 4 or 5 years out. So you have to practice for a few years, and the board has completely changed the way they do things. You have to submit your cases. They review your cases, and if they think that, and if there's something they don't like, they'll actually ask you about that case. Why did you do it like this? And so we prepare people for that test. We prepare people for the written exam. Another arm of the CNS is the journal. So the journal Neurosurgery is actually one of the most well-regarded journals in our space. So I think for the next generation, that's actually a great point. We actually have focused a lot on making sure that the people coming behind us benefit from whether it's technology, whether it's we had a product called Nexus, which is actually free. Where you can go in and watch master surgeons do operations, how they did it, how they selected patients, those sorts of things. That's actually been very important to us to make sure that we leave the field better than when we found it. And so I would say a lot of technology, a lot of online initiatives have really been our legacy. And those were initiatives that we are most proud of.
So there's a human element to being a neurosurgeon. I'm just curious, now, what type of advice would you have given your younger self when dealing with complications or non-ideal situations in the OR?
Yeah, I mean, there's a lot of books been written about this. Atul Gawande is famous for having written a book called Complications, which is a nice book. Neurosurgery in general, and neurosurgery is one of those fields where you can do the perfect operation and the patient has a terrible deficit afterward. And you have to go back and look at things that you did and what you would have done differently. And you have to be super honest with yourself and critical about what you did. I do it a lot more now, but I wish what I had done earlier in my career was record more of my cases under the microscope. I have a pretty good collection of cases now in terms of like imaging and histories, but I wish I had done that with every case. You can learn from every case. So whether it's saving one screenshot of an MRI or a clip of video from a case, I do that more now, but I wish I'd done it when I was younger. So I could have gone back and looked. And a lot of the younger surgeons in our practice do that now. Every case under the microscope gets recorded. Imaging now is so easy to get to. It's all digital, right? So you can download the images. So I wish I had been more cognizant of that sort of aspect of things, keeping track of things. Because then you can look back and say, I did a case just like this. Here's how I did it. You can go back and look. And I think that's something that I wish I had done. I think the only advice I give people if they're going into academics is there's a book by a guy named Joseph Simone. It's called Simone's Maxims. He actually wrote an article in 1999 in Clinical Cancer Research. And he, in that article and eventually in the book, he talks about how crushing being in academics can be. And there's a lot of good advice. That book, I actually found it sort of late in my career, probably about 3 or 4 years ago. I recommend that anybody going into academics pick up a copy of that book and read it, because it really puts in perspective certain things. And I'll give you an example of one of them. There's a maxim in there called institutions don't love you back. And what that means is the time horizon of an institution is way longer than your lifespan, right? Harvard Medical School isn't looking at what am I going to look like in the next 10 years? They're thinking about it in 200 years, is Harvard going to be the best place in the world still, right? But you've only got 20 years on this planet, in your professional career, 25, 30 years probably as a neurosurgeon where you're going to make your mark. And so, be cognizant of that. Just sort of, don't let the institutions kind of chew you up and spit you out. At some point, wherever you're working is the best place to be until it isn't. And then if you're going to make a move, the place you're moving to, you want to be pulled to. You don't want to be pushed out. You want to go somewhere where you're excited, where you're, you're excited to be there. And you also have to recognize that the grass isn't always greener. So even though it may look great, once you get there, there's a honeymoon period that wears off. But you want to be happier than you were than where you were before. So that's my last bit of soapboxing is check out that book.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.